One of the easiest ways to have your eye drops put in is if someone else does it for you, but they need to know what they're doing. The basics are still the same. They need to put the correct drop into the correct eye at the correct time. You need to check that the drops are suitable for you. Whoever's going to put the drops in for you, or if you're putting drops into someone else, remember to wash your hands. Clean hands reduces the risks of introducing any infection at the time of using the drops. The positioning when you're putting drops into someone else is fairly straightforward. Your patient can either lie down flat, such they're looking up at the ceiling, they can sit up and then extend their head, or in fact, as you get better at it, sometimes they only need to turn their eyes up to the ceiling. It's once again worth practicing with the dropper. Make sure you're familiar with how much pressure you need to apply just to get a single drip to appear. The first technique is probably the easiest, and that's with your patient lying flat on a sofa or flat on a bed. They look straight up at the ceiling, you pull their lower lid down and drip a single drop into the gap created between the lower lid and the eye. Once again in close-up, so the patient's lying down, they look upwards, a large space is created, and you simply drip a single drop into this space and then let go of the lower lid. The drop is in position. If your patient is sitting, then they look up towards the ceiling and you do exactly the same, only this time the tip of your dropper comes a little bit closer to the patient. It's very important that the tip of the dropper doesn't touch the patient's eye or eyelid, but because you can stabilize your hand gently on the bridge of their nose, this is still a very safe and effective way to put drops in. With experience, when you get better at it, you can actually even put a drop in without your patient tipping their head backwards. Here you can see the first strip misses, but the second one goes onto the surface of the eye. Again, without the patient extending their neck, pulling that lower lid down gives an enormous trough into which you can drip that drop. Each of these techniques is effective. Once done, remember, as ever, replace the dropper lid and put the bottle away safely and get ready to put the next drop in, because the next drop will be due before too long.